So what makes marionette lines different from wrinkles and other lines in other areas of your face? They're very much of a focus because of different advertising campaigns, the fact that we take selfies every single day, and the fact that we're more concerned about what we look like. Video chats, we're in the mirror, and we're on camera a lot more than we ever were before. So a brief explanation. You lose 1 teaspoon of collagen from your face roughly every year from the time you're 30. So it's not until you get into your 40s and 50s and look in the mirror and you think to yourself, oh my God, I look like my Aunt Peggy, I look like my Aunt Eleanor. What's going on here? It's because you've lost all those teaspoons of collagen. 1 teaspoon of collagen equals 1 syringe of filler. Now at 50, nobody's gonna put in 20 syringes of injectables into your face, not at all. But the point is that you wanna realize that you're starting to lose collagen from your face is starting to fall, and in addition, we're laughing, we're talking, we're chewing, we're eating. So these motion lines become something that nobody wants and nobody wants to have. So we figure out different ways to address them. In terms of shallow marionette lines, perhaps you're going to the dermatologist and you're asking for some type of a retinoid-based cream. Those creams are going to actually build collagen, build elastin, and help to decrease fine lines and wrinkles, including the lines here. You can actually do injectables where you're putting a little hyaluronic acid in the cheeks up here. So you're picking the face up, as I like to tell my patients, from this angle of your face, or you're picking the face up from the middle of your cheek. That can be made to look very, very natural. However, if you're only filling in for, say, deep marionette lines right here, that can give you a look that's not real, because even babies have nasolabial folds. So I tell my patients for deeper marionette lines, you probably have to use more filler, more anti-aging products, that type of thing. You also want to start sleeping on your back. If you sleep on one side of your face over the other side of your face, you can actually shift your skeletal structure over time, and that's regardless of whether or not you smoke. But if you smoke, you would be able to shift your skeletal structure a little bit faster. So I have my patients try to sleep flat on their back, not smoke at all. And then I tell them in terms of the deeper marionette lines that they need to remember that they didn't get deep overnight. They're not going to be fixed overnight. So we do a little filler at a time and we put them on an anti-aging regimen. Those things are really important. And then in terms of risks of treating deeper lines, there's always risks every time you do cosmetic procedures, so you need to go over them with your board-certified dermatologist or plastic surgeon. In addition, the last thing that my plastic surgery friends would say is that you could always lift with plastic surgery. But I tell my patients, even when you lift with plastic surgery, you're still going to need filler. So I recommend filler strongly because I feel like that looks a lot more natural for people as they age.